Hi, you guys. Welcome back for our daily practice questions. It is day 32 and it is officially February. February is heart month, hence the red letters. But y'all know now that it's heart month, we'll be covering everything cardiac. And if you're familiar with me, y'all know cardiology is my thing. But as always, before we get started with our questions for today, let's get into my introduction and disclaimer. And in true cardiac fashion, y'all know I had to do a little spin on it because, like I said, I love everything cardiac. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion, okay? But before we get into our question, I wanted to just share a little bit really quickly because, like I said in the beginning, is that it's February, it's Heart Month, and as you can tell, I've been working through the systems with you guys. So we've covered EENT, we covered respiratory, and as it's Heart Month, hey, we're going to cover all of cardiology, right? So I'm going to make sure you have the cardiac stuff down and we'll continue to do our thing. We're going to continue to work through these systems, but you know the flow at this point here is that we'll do daily practice questions so you are practicing on how to apply the knowledge that you have, right? And during a couple of my one-on-one sessions this week, it stood out to me because people were asking more about what I do personally, and I guess I often forget because those of you who are new to me, I guess y'all really don't know. And a lot of my people who have been around for some years know that cardiology is my thing. I have always worked in cardiology. I am a family nurse practitioner, but I started at a cardiac hospital, even as a nurse. And so I worked cardiology, inpatient, outpatient, women's heart, all of the things. I have done everything cardiology that you can think of, structural heart, all of the things. So cardiology is my thing. I worked at this hospital for 15 years, and then I left, and I have been all in doing the nursing studio things. I still am clinical, but a year ago now, I opened my own women's heart center. And so when we were, I should say women's heart office, and it's called LAG Heart and Wellness Consulting. And I was talking to a reviewer this week. She's a student, and she was asking me about it. And people are shocked. And I'm like, I don't know why I just assumed that y'all knew that I was still clinical or whatever, but I don't know. But yeah, I still do practice, and I opened this just because for years of experience in cardiology, women's heart stood out because a lot of things are often missed. And then when I led and ran the Women's Heart Center for our hospital, I saw how much it was needed and how much change and how many things that not so much that is not done, but you need to pay attention to the different factors with presentation and focus a little bit differently on certain lab values and certain things at certain age, age brackets, I should say. And it just turned into my thing. And I mean, even my doctoral project was on women's heart and creating a women's heart center. And I didn't think I was going to be here, but look, God put me here. So this is what we're doing. So it is LAG Heart and Wellness Consulting. I was asked why and what does LAG mean. And those of you who are familiar with me, my husband and I have three daughters, right? Layla, Ava, and Grace. So that's the LAG. Those are a big part of my heart. So, women's heart. And they're going to grow and be women one day. So I need them to understand the appropriate things to do and understand their body to be able to advocate for themselves as well. And so with LAG Heart, do I not serve men? No. And I do a lot of screening events and things, and it's open for everyone. But my primary focus is women so that we know the different changes, for example, like during the periods of menopause and how the impact and shift in the risk factors increase for women. So just making sure that you're able to advocate for yourself. But yeah, that's my spiel. That's my background. That's a little bit more about me and all of the things that I love about cardiology. So again, when they asked this week, it kind of shocked me because I guess I'm just so used to everybody knowing that I do cardiology. Like I still have people who passed boards back in 2017 that work with me, and they still, if they have a cardiac patient or if they have EKGs that they want someone to look over or to kind of have like a peer-to-peer talk about it, we do those things. So I forget that I have to reintroduce myself to you guys. So hey y'all, and thank y'all for being here with me. I don't take it lightly, but yeah, that's a little bit more about me. And she was also asking about, do I teach at universities? I have taught at universities in the past. I do not currently teach at any universities. I am fully doing the nursing studio, and I also, like I said, I work in my women's heart office. But enough about me. Let's get into our questions for today. Question number 1. A 58-year-old male is diagnosed with hypertension after 2 separate office visits, each showing a blood pressure reading of 150 over 95. His medical history includes mild hyperlipidemia, and he is overweight with a BMI of 31. According to the ACC and AHA guidelines, what is the most appropriate initial treatment for this patient? Is it A, lifestyle modifications alone? Is it B, thiazide diuretics? Is it C, a calcium channel blocker? Or is it D, a combination of an ACE inhibitor and a calcium channel blocker? Take a moment, tell me what you got in the comments, y'all. Tell me what you got. Tell me what you got. And y'all, we've been doing hypertension, so let's get into it. I want to make sure that y'all know how to answer hypertension questions because I know that we do things differently in practice. And also, y'all, with me telling you about my cardiac background, that's why I'm always like on the spiel, like, y'all, trust me. I know that we do hypertension management different in practice. I know that we may start with this differently in practice because of things that we know or because of this particular patient. But you are preparing for boards. They are going specifically by the ACC and AHA guidelines. Everything is like I was taught in undergrad. It's a perfect world on the boards. It is like ivory tower is how they used to always say it in undergrad on boards, right? So you got to walk through this thing like that. So I am teaching you how to be successful on boards. Now, after you pass boards and we want to talk about practice stuff, contact me. I am happy to tell you those things too. But for boards purposes, make sure you know how to answer these in this fashion, okay? So y'all know I always tell y'all to read the stem of the question first. Here, the stem of the question states, according to the ACC and AHA guidelines, what is the most appropriate initial treatment for this patient? So again, if they're telling you about treatment, you need to run it back and look and see if a diagnosis has been provided. Here it has. This is hypertension management. It's a 58-year-old male. He had 2 separate office visits where his blood pressure is reading 150 over 95. He does have a history of mild hyperlipidemia. He is overweight. BMI is 31. What are we going to do with this patient, right? Y'all, B is your best answer. We go with a thiazide first, right? Remember, I always say that you have 4 first-line therapy options for hypertension. Thiazides, ACEs, ARBs, and calcium channel blockers. With thiazides, I call it the captain. Thiazides is the captain. It's the top of that first-line therapy, unless there are reasons why you can't give a thiazide, like they have gout or sulfa allergy, etc., right? But let's keep doing the questions so that we can break down some other alternatives while you would use the other ones first, okay? All right, now question number 2. A 62-year-old female with hypertension, diabetes, and chronic kidney disease presents for follow-up. Her blood pressure is 145 over 90. According to the ACC and AHA guidelines, which class of antihypertensive medication is considered first line for patients with hypertension and chronic kidney disease? Is it A, an ACE inhibitor or ARB? Is it B, beta blockers? Is it C, calcium channel blockers? Or is it D, thiazide diuretics? Tell me what you got in the comments, y'all. All right, so stem of the question here, according to the ACC and AHA guidelines, which class of antihypertensive medication is considered first line for patients with hypertension and chronic kidney disease? Look, this right here, again, is an example of the stem telling you everything you need to know to answer this question, right? They're only asking which class of medicines do we use as antihypertensive medicines for patients who have hypertension and CKD. And your best answer is A. We use our ACEs or ARBs, right? So again, our starting first line therapy options, there's 4, right? Thiazides, ACEs, ARBs, or calcium channel blockers. The time that we use ACEs or ARBs first over anything out of that first line therapy category is if these patients need renal protection. That is the most prominent aspect of these medicines. And so patients who have diabetes and kidney disease, we need to protect their kidneys even more. They need renal protection, right? So we're going to do the ACEs or the ARBs. ACEs or ARBs, right? ACEs or ARBs. This is when we do this. All right, question number 3. A 45-year-old male with a history of hypertension is being treated with a thiazide diuretic. His current blood pressure is 136/88. According to the ACC and AHA guidelines, what is the recommended blood pressure target for most adults with hypertension? Is it A, less than 130/80? Is it B, less than 140/90? Is it C, less than 150/90? Or is it D, less than 120/80? Tell me what you got. Tell me what you got in the comments, y'all. All right, so stem of the question here. According to the ACC and AHA guidelines, what is the recommended blood pressure target for most adults with hypertension? All right, so the stem here tells you everything you need to know, but let's walk through. We have a 45-year-old male. He has a history of hypertension. He's already on a thiazide. His current blood pressure is 136/88. Now they're asking, according to the ACC and AHA guidelines, what is the recommended blood pressure target for most adults with hypertension? The key here is with hypertension. Don't y'all go so quick and jump and say less than 120/80, right? Yeah, that's our standard goal, but that's before you get hypertension. We want you to stay below that so we don't have to give you that diagnosis of hypertension, right? Remember, when you exceed 120/80, that's considered pre-hypertension up until the 130/80, right? So people with hypertension, we want to target to keep them less than 130/80, okay? So A is your best answer. Think of this just like the A1C levels with diabetics. So make sure that you are paying attention if it's telling you with hypertension or what is the goal in general. If they have hypertension, our target goal is to keep them less than 130/80, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure y'all meet me back here. We'll be working through everything cardiac this month. We'll be covering everything hypertension. We'll be talking about murmurs. We'll be talking about cholesterol and appropriate management. We'll be talking about murmur grading. We'll be talking about all of the things, PAD, CVI, all of the things, Raynaud's disease, all of the things, okay? So make sure you are locked in so that you don't miss out. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I do offer is linked here in the bio of this channel, including my website. But as always, if you're looking to book any of my one-on-one sessions or any of my custom packages or plans, that I always say either call, text, or email because I prefer to speak with you so that I can gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.